My name is Bobby Lilly. I'm an RN and I'm in the BSN program at Bluefield State College. I want to talk to you today about physician-assisted suicide and whether or not it should be legal in all states. I'd like for you to take a minute and imagine that you are 29 years old. You have been married just a little over a year when you were diagnosed with a grade 2 brain cancer. You've been told there's no cure and you have approximately 3 to 10 years to live. You go through radiation, a partial craniotomy, and temporal lobe resection. During this time, you have continued to have seizures and debilitating headaches. A couple months after your surgeries, you go back for a follow-up, and your physician tells you that the tumor has grown and you now have a grade 4 brain cancer and have less than 6 months to live. This story is the reason that I chose this topic. This is the true story of Brittany Maynard. Brittany was a California woman who had this brain cancer, and after being told of the horrifying and painful death that she would succumb to due to her disease, she and her husband decided to move to Oregon to take part and have access to their Death with Dignity Act. Brittany had decided that she wanted to spend the rest of her days enjoying time and spending time with her family and friends, and wanted to choose the right time for her when she could no longer endure the pain and suffering to take the medication and to be able to die a dignified death and a peaceful death. This story was very highly publicized in the news and social media, which reignited debates again about the subject and how people feel about physician-assisted suicide and whether or not it should be legal. Physician-assisted suicide actually consists of the physician giving the patient the means to end their own life, usually by a prescription of barbiturates. The patient must be able to independently administer the medication to themselves by their own hand. Currently, there are only 5 states where physician-assisted suicide is legal. Those are Washington, Oregon, Montana, New Mexico, and Vermont. We have such a horrific and poor idea of suicide that it sways, I think, sways our opinion of how we feel about physician-assisted suicide. A Gallup survey showed that 71% of Americans, when asked, were in support of doctors ending a terminally ill patient's life in a painless manner. However, when the question was reworded, only 51% were in agreement for the physician to assist a patient in suicide. So I think the term suicide negatively affects how we feel about the subject. There are a lot of legal and moral and ethical considerations to take into account when deciding how we feel about physician-assisted suicide. Many people feel that it should be legalized for the terminally ill patients. This can give them some sense of comfort in knowing that they have some control over their disease and how long they have to endure the pain and suffering. A lot of common concerns voiced by these patients are who request the lethal dose of medication is the decrease in their ability to participate in activities that they enjoyed, and the loss of dignity, and losing their autonomy. Most of us, if we are diagnosed with terminally ill, as a terminally ill patient, we do not want to live, we do not want to live a long and painful death, and we don't want to expose our families to have to watch us suffer through this and lose control of our bodies and bodily functions. Physician-assisted suicide is not for those patients that have suicidal thoughts or thoughts of hopelessness, and it's due to some of those concerns of maybe abusing the law for those types of patients that the states where physician-assisted suicide is legal has criteria that has to be met by the patient. Some of the criteria in Oregon for the patients to receive the medication is that the patient must be fully educated and informed of their illness and of the medication that they'll receive, and make a voluntary request for the medication. They must be diagnosed with a terminal illness and less than 6 months to live by 2 physicians. They have to verbally request for the medication 2 times, and a 3rd time as a written request. The patient does not have to take the medication. They can choose not to take it once they receive it, and they can cancel at any time. They are provided counseling if deemed necessary by the physician, or if the patient requests for psychological counseling. It's not the role of the physician to tell the patient what to do. The patient needs to or must make that decision on their own, based on their own moral and ethical values. Approximately only 1 in 1,000 patients who obtain the medication use the lethal dose of medication in Oregon. Those who are against legalizing physician-assisted suicide believe that palliative care is the most appropriate treatment for end of life. And they feel that if palliative care is applied with skill and experience, then that could adequately treat end of life suffering and pain for the most part. Also, if end of life care is treated in a timely manner and patients are referred to some type of hospice program in a timely manner, and it can be treated adequately, there would be no need for assisted suicide. Palliative care also has alternatives to physician-assisted suicide. For treating discomfort and intractable pain, they can use accelerated opioids, and palliative sedation could also be used for the pain. Discontinuing life-sustaining therapies such as mechanical ventilation, tube feedings, and dialysis can also be discontinued to ensure a more natural death for these patients. Another argument against legalizing physician-assisted suicide is based on religion. Most people feel that suicide is still suicide, which is equal to murder in the Bible. It's argued that God is the giver of life. He gives and he takes away life, and by suicide the person is rejecting God's gift of life, and that no man or woman should take God's authority upon themselves to end their own life. Suicide is a sin and is against the 10 Commandments. The Catholic Church also criticized Brittany Maynard's decision to die with dignity. The Pope stated that euthanasia is a sin against God, and the Catholic Church also condemned her for deciding to die with dignity, stating that choosing to end your own life is different than dying with dignity. There are concerns, if legalized, that the law could be abused for our vulnerable population, like the elderly, the disabled, the minorities, the poor. The New England Journal of Medicine did a survey, and it showed that 67% of physicians are actually against physician-assisted suicide. As nurses, we also need to consider our role in physician-assisted suicide. The ANA Code of Ethics states that nurses are to provide intervention to help relieve pain and suffering. However, we are not to act with the sole intention of ending a patient's life, even if that action is motivated by compassion and quality of life. The ANA also believes that we should not participate as nurses because it is in direct violation of the Code of Ethics for nurses and ethical traditions and goals of the profession. However, nurses typically do not have an active role in physician-assisted suicide. Most of the role of the nurse is to provide care and comfort to the patient and their families. And and to provide education and information if asked. In closing, I want to tell you how Brittany's story ended. As I said earlier, Brittany and her husband moved to Oregon, and she was granted the prescription for the lethal dose of medication. Brittany had set a goal to make it to October, to the end of October for her husband's next birthday. Brittany was able to do that. That was October of 2014. And during that time, she continued to have an increase in the frequency of her seizures, more debilitating headaches and excruciating pain. And on November 1st, Brittany took the medication with her family and friends at her bedside in her home and died a very peaceful death and a dignified death. And that was the way that she had wanted her life to end. After researching the options and whether or not this should be legal, I haven't decided how I feel about legalizing physician-assisted suicide in all states. However, I can see that there would be some comfort in knowing if I had a terminal illness and was going through long bouts of pain and suffering, that there would be an option for me to end it if I felt that I could no longer take the discomfort and did not want my family to have to endure the pain and suffering along with me.